Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Tushar Mehta, a name which is a very well-known name in orthopedic as an orthopedic surgeon. He is currently the director and head of Orthopedics Plus and a well-known academician and a teacher attached with one of the well-known institutes, and has been teaching students since more than a decade, helping them clear their examinations, their masters, and guiding them, motivating them, helping them to just get through their phases of life. Welcome, sir, to the platform. It's really nice to have you here.
Thank you so much, Dr. Ayushi. Thank you so much. It's my pleasure to be on this platform with you. Thank you so much.
Yes. So today, as mentioned, we are going to discuss your journey as an orthopedic surgeon. How did you plan to get into this? What was your mindset? And suggesting the current medical students, how can they pick up and what should be their mindset when picking up, orthopedics as their masters. So anything from your end, sir, why did you pick up this as your, specialty branch, and what was your mindset when you did that?
See, basically, I come from a small town in Haryana, and coming from a medical background, so my dad is a doctor, so I was pretty clear with this fact that I like this field, I want to pursue this ahead. But when I entered into MBBS, I was, of course, not very much decided that I'll take up orthopedics. Of course, I had in my mind, because I had seen as a kid one or two people into the field. But when I actually entered inside the field and I realized that this is something that I can relate to, this is something that I want to do. So basically what we do, this is an advice for everybody watching right now, that if you are in MBBS right now, you have to understand that whether your gut says that you're a medical person or a surgical person. When I say medical person, that means medicine, pediatrics, dermatology. When I say surgical person, that means general surgery, orthopedics, OBGY, obs and gynae. So ये अंदर से आता है, मतलब it has to come from within, that whether you belong to which aspect. So one thing for me was very clear, that I belong to a surgical stream. Now, in surgical stream, I was not pretty much convinced with general surgery. One major reason was that, you have to study another 3 years. Once you are done with your MS, you have to study another 3 years for MCS. So, of course, that was one of the reasons. OBGY was totally out of the scene. In North India, there's still a taboo that males, they don't, they are not entertained as just by the patient. So, by default and by choice, I'm so happy that for me, both ways, orthopedics was the branch of choice. And I'm telling you that, I was seeing the evolution. Like as a MBBS student, all I knew was that orthopedics is all about fracture. Fracture is all what it is in the branch. But at that point of time, we never knew that, you deal with joints, you deal with joint replacement, you deal with some arthroscopic surgery. I, as an MBBS student, was totally not aware of arthroplasty and arthroscopy, that is joint replacement, and the minimal invasive surgeries of orthopedics. For me, it was strong, simple, straightforward. So when I actually came into internship and I got to know that, orthopedics is no longer a branch which is limited to just trauma, it has something beyond it. So that was the point of time when I got even more inquisitive, and during my preparation for PG entrance, I was kind of determined that if at all I get an opportunity and I get the chance, I will definitely take orthopedics. So that was how I, figured out my way during that 4.5 years.
So, sorry, I'm so sorry. Yes, sir.
So, and this is something that I want people to know. If anybody who's in MBBS first year right now, I can totally understand that it is very difficult for you to choose your branch, because I get a lot of messages on Instagram and other social media portal that I'm in second year, I'm in third year, I don't know what I want to pursue further. That's okay. You find your own way as you move ahead. So you go through and then you grow through. Your mind, you have a well-formed and informed mind, and then you take your decision depending upon how you're disliking a branch. So that goes out of the scene. So by default, you reach to a conclusion. But this is something which is not an overnight decision. Like you, while sleeping, you think about it, and in the morning you wake up and you decide ki I will become a dermatologist. No, it is not like that. You have to go through it, you have to grow through it, and it has to come to you. We don't choose a branch. I mean, there's a very cliche saying. I mean, I say this very often. We don't choose a branch. The branch chooses us.
Hmm.
सो हम नहीं चुनते हैं, वो हमें चुनती है, और वो धीरे धीरे अपने आप आपके पास आएगी। जैसे जैसे आप अपने सफर में आगे बढ़ते जाएंगे, कुछ चीजें अपने आप हटती जाएंगी, कुछ चीजें जुड़ती जाएंगी, एंड यू विल कम टू द कंक्लूजन।
Correct, correct. And choosing a branch is something, it's a very important part of your life. It's just it just changes the whole
You
thing.
have to you have to live with this forever. I mean,
Yes,
I always say that choosing a branch is even more important than choosing a life partner. There
that's
you still have a choice. Here you don't have a choice. 10 years down the line, you can't say that, oh, I'm not liking it, and I want to leave it, and I want to, again sit for entrance, and I want to
mm,
prepare again. That is not possible. And 30, 40 years of professional life, once you enter into a branch, are actually going to be dependent upon how much liking and how much passion you have for that. So you
mm,
have to be, you have to have the love for it, and you have to have the liking for it. You have to have both of it. I see some people, they say, sir, I'm passionate about neurosurgery. I said, what do you know about neurosurgery?
mm,
Sir, it is a very cool branch. I
mm,
said, that is something which is your passion. You may not even love it once you see a head injury patient coming to you with an emotional turmoil of 50 relatives and everybody sitting onto your head. And even if something goes wrong, and then you will be, you will be at everybody's gunpoint. So having a passion and loving something or liking something, these are two different things.
correct, correct. Absolutely, you correctly said. So now, sir, when if any student wants to pick up orthopedics as their masters, there are two things that they can do: either MSNet or DNB. There are different kinds of mindset attached to it. If you can actually help people understand and get a clarity on that.
So I'll tell you how, the things have evolved in the last 15, 20 years.
Mm,
First of all, there's a very wrong notion in most of the people that DNB is diploma. It's not diploma. The full form is Diplomat of National Board. It is started by the NBE, National Board of Education. NBE, when it started
mm,
decades ago, NBE was an alternative agency to the Medical Council of India. So we had a MCI, which was the
mm,
main body, and we
mm,
had an NBE, which was an alternative body. Now, gradually, what happened? NBE kind of took over the whole scenario, as most of the people know right now.
mm,
But technically, it was not at one point of time. Now, NBE, since it was an alternative body, it started a different set of postgraduate degree exam, and that postgraduate degree exam was called a DNB. So
okay.
people thought this is some kind of a diploma, although it was Diplomat of National Board.
Mm,
It is a proper MD/MS degree.
mm,
It's
mm,
equivalent to MD/MS. There are guidelines, there are protocols, there are documents saying that.
mm,
Now, what happened is that for about a decade, or even more than that, DNB was considered very, very inferior to MS and MD.
that's true.
But that was just in the mindset, that was not on the papers. On the papers, many a times MCI and NBE have given a joint statement that both are at par.
Mm,
But the mindset of the country till about, I would say, 2013, 14, 15 was that no, DNB is anytime inferior to MS and MD. Why? Because MS and MD is done in a government medical college, or even in a private medical college, where you have professors, you have cases, you have
mm,
patients. DNB is more or less done in corporate hospitals like Max and Apollo and
mm,
Fortis and Narayan Hridayalaya and all that thing.
mm,
So over there, you don't have a proper study curriculum, you don't have a proper academic session. So that was the major reason why most of the people considered DNB inferior to MS.
mm,
I when I entered, when I got an opportunity, I had an opportunity of doing MS in a tier 3 city versus DNB in a tier 1 city. This is Delhi. So technically, when I was given a choice, I was given a choice of degree and city. Normally, people choose degree first, then they choose city. I chose city first. So I decided that I'll be in Delhi. I'll do DNB, no problem. It is at par with the rest of the things.
mm,
And somehow I was lucky, and I Today I will not say that, I could see the vision, I could see the future. Of course, I did not do anything. But
Hmm.
then gradually I was lucky and things worked out, and gradually DNB started getting at par even in the mindset of the people. As of now, most of the even the government medical colleges or even the government hospitals, they have started DNB along with the MSNMD.
Hmm.
So
Hmm.
at but DNB is at par not only on papers but even in the mindset.
Hmm.
One advantage with DNB, which is, and which will always be, there is no bond. So when you do MS and MD in a particular state, let's say you go to Rajasthan to do your degree, you're getting any seat in Jaipur, Udaipur, Jodhpur, Kota. So you will be having a bond of say about, I think, 10 years. Assam has a bond of 10 years.
Hmm.
You may give money to break that bond or you may serve that bond. That's altogether a different story, but there is a bond.
Hmm.
DNB, there is no limitation pan India. Nobody will ever give you any bond. So DNB is totally bond free. That is one advantage of DNB over MS. The second advantage of DNB is that in a corporate hospital, if you see yourself, if you see your future,
Hmm.
then there is no problem as such, because a corporate hospital generally tends to prefer more DNB rather than an MS. Why?
Hmm.
Because DNBs already are aware of what is going on in a corporate hospital and how things function. Well, at the same time, there's a disadvantage that if you see yourself teaching in a medical college, then DNB will be giving you a disadvantage, because the medical college mindset is that MS and MD should be preferred over DNB.
That's true.
तो
Hmm.
यहाँ पे ना बड़ा एक क्लियर कट डिमार्केशन है. अगर फ्यूचर में आपको दिखता है कि आप प्राइवेट मेडिकल कॉलेज में जाने वाले हो, गवर्नमेंट या प्राइवेट, तो आप MSMD सोचिए. अगर आपको लगता है कि नहीं यार, यू आर गोइंग टू स्टार्ट योर ओन प्रैक्टिस, you're going to start your own thing, and you're going to be in a corporate hospital, you're going to be self-employed or salaried, DNB is no problem. Last 4 or 5 years, I see people choosing DNB in Delhi, Mumbai, Bangalore rather than MS in the same branch in a tier 3 city, because even students have now understood that staying close to a tier 1 city is going to give them an edge as compared to
Hmm.
going to another city. Because once you come back, let's say if somebody is living in Delhi for last 24 years and he
Hmm.
goes to a in Kerala or Karnataka or Assam, and then when he comes back after 3 years of his post graduation,
Hmm.
the city will move 6 years later, so 6 years ahead. 3 साल
Correct.
शहर आगे चले गया, 3 साल आप पीछे चलेंगे. So लोग अब DNB को ज़्यादा प्रेफर करने लगे हैं, और it is excellent. The only hitch which was and which is to an extent right now is the pass percentage. So when
Hmm.
I joined DNB Orthopedics at that point of time, the pass percentage was less than 10%.
Hmm.
It was very irritating at one point of time. It was very disheartening at one point of time. I cleared theory in first shot and practical in first shot along with the gold medal. So I mean, I could not see any problem, and people around me also were able to clear it.
Hmm.
Today, I would say the pass percentage of DNB in a surgical branch has moved up to 50, 60, 65%.
Hmm.
So the pass percentage has gone up. Of course, you need to work harder in DNB. Why? Because if you're doing DNB from an ex hospital, then the people who are there, your HOD and your everybody in that hospital, they're not going to be your examiner.
Hmm.
So they're not going to influence your exam at any cost, because a theory exam will be conducted nationwide. Then there will be a practical exam for which you will be allotted a center which will be far away from the place where you have done your DNB from.
Hmm.
So technically, you can go to any ex city in any ex medical college where the professors of that medical college, whom you will be seeing for the first time in your life, they will be your internals and there will be two more externals.
Hmm.
Technically, the people whom you have worked under for last 3 years, they don't make any difference to your exam. So
Hmm.
that means the two internals will be technically two external. I mean, you will not have two external, you will have four externals. सारे चारों आपके लिए तो बाहर से होंगे, क्योंकि आप तो किसी को भी नहीं जानते.
बिल्कुल.
So that is a very big disadvantage. But at the end of the day, I see that as an opportunity, because you tend to prepare more, read more. You become very solid theoretically, because you know that at the end of the day, no HOD, or if somebody is good in the eyes of an HOD or some other professor, you have a fair chance of clearing it. So यहाँ पर ऐसा कुछ भी नहीं होगा. यहाँ पर आपको आता है तो आप पास होगे, आपको नहीं आता तो आप नहीं पास होगे. And that is probably
Hmm.
one reason pass percentage कम है.
Hmm.
So ये broad comparison है DNB और MS का. DNB in certain branches is amazing. Like DNB radiology, superb. DNB dermatology, superb. ये दो ब्रांचेस के अंदर आप आंख बंद करके कहीं की भी एमडी छोड़ के आप डीएनबी उठा सकते हो. दे हैव गॉट अमेजिंग रिजल्ट्स. आई विल गिव यू वन एग्जांपल. देयर इज अ government medical college, let's say a tier 3 city of Haryana, Assam, Rajasthan, or anywhere. Do we expect a similar radiology department, a similar radiological modality like CT or MRI or bone scan or PET scan as compared to a hospital like Fortis in that tier 3 medical college? No, we can't. The exposure of radiology that you are going to get in a Fortis, in a Max, or in a Apollo, or in a Narayan Hridayalaya is way more and more diverse than that you are getting in a government medical college of a tier 2-3 city. Most of the tier 2-3 medical colleges, government colleges, they don't even have proper updated machines.
That's true.
DNB dermatology and DNB radiology are totally advisable. DNB in medical branches, from a superlative institute, from superlatives, I mean, there are 10, 12 amazing hospitals in India which provide the best academic curriculum during DNB. I mean, you can just close your eyes and take them. DNB surgical branch, you should think of it. You should take only good institutes and where there is a proven academic session, where there's a proven cutting rate system. So I think this is how we summarize and we take a calculated bet that whether we should take DNB or not. In dermatology, radiology, I'll summarize, it's a safe bet. In medical branches, medicine, PD and all that, it's again a safe bet from a good institute. DNB in surgical branches, you should think a bit. But at the end of the day, I mean, if you're spending a lot of money in a private medical college, I think better is to take DNB in any government or private hospital and save that money.
Exactly. So, now understanding that actually MD and DNB, it does not make any difference now. Now, going forward, people are sometimes scared of picking up surgical branches. They think it's too tough to deal with. It's difficult to go through these branches, and especially during their, in their initial 3 years. What do you suggest them, and how can they, how is the picture actually, if you can express?
See, I'll tell you, basically, there's a word which is quite prevalent in the new generation these days: toxicity. So I get a lot of messages and I see a lot of posts on Twitter also that I've joined post-graduation and there's a lot of toxicity. Seniors are not congenial and the environment is not cordial and the department is not favoring me. I'll tell you basically what has happened in last couple of years, particularly because of COVID. Most of the people who were in the MBBS at that point of time, 3 years ago when all this happened. So after that, the exposure to the college and exposure to the hierarchical system of a department has been very less. And that is one reason most of the people, they don't understand that at the end of the day, when you enter into any organization, whether that is a multinational company, that is into the medical college, that is into a corporate hospital, or that is even in the armed forces, there is a hierarchical system. You have to follow that. There is some amount of mixed emotions which are going to be transmitted from the top to bottom. They expect something from you, they expect you to do that thing, and there are no exceptions. So when you do not meet that criteria, then it is possible that your superiors might not be very happy with you. At that point of time, I mean, you have to just understand one thing, that it is just a phase. It's not something which is going to be with you forever in your life. It's just a phase. It's just a couple of hours or a couple of days or a couple of weeks. They're not going to last forever. They're going to end. That this is going to end for sure. So at that point of time, if you hold your confidence and if you basically, if you look at the optimistic part of it, because I see, like, if any department in these 3 years, if they have got, let's say, about 14 faculty people in all possible hierarchies, 5 can be toxic, 8 can be toxic, 9 can be 10 max. What about the remaining 5? So you have to find your person whom you can go up to, whose shoulder you can take to cry upon. And it is okay. I mean, it is absolutely okay. This training is a rigorous one and we all are aware of it. The problem is that before we enter into it, we have a lot of expectations. Like I see a lot of young doctors who are getting into the first year PG, and they expect it to be, kind of a bed of roses, that I've got this rank and I've been interviewed by, the academic institutes, and there's a bed of roses in front of me, and I'll just walk over that, and somebody will be standing in the OT with a scalpel in his hand and will be just handing over it to me. No, this is not going to happen. You will have to start from the scratch again. And in that effort, you have to be enthusiastic, you have to be a patient listener, and you have to be a keen observer. And the most important part is that you have to be very good in ignoring certain things. तो ये जो 3 साल की जो जो जहमत है, इसको उठाने के लिए आपको सिर्फ 4 बातों का ध्यान रखना चाहिए। एक तो आपके कान हमेशा खुले होने चाहिए, दूसरा आपकी आंखें हमेशा खुली होनी चाहिए, तीसरा आपको जो बात पसंद ना आए वो आपके दिमाग में रहनी नहीं चाहिए, चौथा जो सबसे इम्पोर्टेंट है वो ये है दैट यू हैव टू जेल अलोंग विद एवरीबडी। सो वो थोड़ा सा, इफ यू आर अ बिट ऑफ एन एक्सट्रोवर्ट पर्सन एंड यू जेल अलोंग विद द रेस्ट ऑफ द डिपार्टमेंट, देन थिंग्स बिकम प्रिटी सिंपल फॉर यू। मेरा लाइफ में एक ही मानना है, टेक इट इजी, इफ नॉट देन मेक इट इजी। तो अगर आसान नहीं है जिंदगी, तो उसे बनाना तो आपका काम है ना। तो वहां पर उन 3 सालों में अगर आप अपनी जिंदगी को आसान बना लें, अगर आप कोहेरेंटली सारे लोगों के साथ जलब कर जाएंगे, तो आप प्रोफेशनली ज्यादा सीख पाएंगे, ज्यादा लंबे समय तक सीख पाएंगे। तो उन 3 सालों से डील करने का कोई बुलेट प्रूफ मेथड नहीं है, सिर्फ एक ही मेथड है, दैट सबके साथ बना के रखो, सुनो सबकी, करो मन की।
बिल्कुल।
और दिल पे कोई बात मत लो।
That's true. This is a very important thing to follow. So now, sir, when you mentioned कि toxicity के बारे में, normally girls have this in mind कि orthopedics हमें लेना चाहिए नहीं लेना चाहिए, क्या हमारी standing है कि नहीं है. So if you can discuss on that.
Uh, I have been tracking this for the last about 14 years now. So when I entered into it, I totally remember that I got to know that there is some girl who is doing post-graduation in orthopedics in Mumbai. And I was shocked. I said, how is that even possible? वो कर कैसे सकते, हो कैसे सकता है, हो ही नहीं पाएगा. Because there's a lot of muscle power. I had not entered by that time. I was in the process. So I said, इस पे तो muscle power चाहिए, तो हो ही नहीं सकता. At this moment right now, when we are talking, there are 217 girls who are pursuing or who have pursued in orthopedics, who have pursued orthopedics in the last 4 years, I would say. Yesterday itself, I came across a post of one of my students. She was my student she cleared PG entrance in 2017. So she joined in 2017, 18, 19, 20, 20, she cleared 21, 22, now 2023. I was so happy. This happened, I mean, just deja vu, this happened yesterday. I was just scrolling Facebook and I see a post. I would name her here because I think that's an inspiration. So Dr. Ketika Mohite, I hope I'm pronouncing it right. And I just while scrolling Facebook, I saw a post by her, and she's sitting in her chamber, and there's a visiting card in one of the photographs that orthopedic MS orthopedics, and her clinic name was mentioned. I think it was in Pune. So felt so good. And then I congratulated her, and then she messaged, and I saw her message that 5 years ago she had messaged me that I chose orthopedics, and you're one of the reasons for that. So I am telling you that if we go down south, like from Gujarat and towards Maharashtra, towards the southern part of the country, there are a lot of girls who are pursuing orthopedics. They're doing amazing in trauma, in scopy, in pediatrics, pediatric component of orthopedics. So still, I would say in Haryana, in Punjab, in Delhi, there's still a taboo, but it has been completely shattered and broken in the rest of the country. And girls are doing amazing in orthopedics. In fact, pediatric orthopedics is now kind of ruled over by the female orthopedic surgeons, and there is nothing wrong in it. The 70% of the country has changed its mindset, remaining 30% is on its way. And I'm sure, it is an amazing branch. If you want to pursue it, there is no problem. And there is just a misconception of muscle power and all. Lean, thin person. I can name 5, 7 top-notch orthopedic surgeons of the country. If you will Google them, you will find that their height is maybe not more than 5'6", 5'7". Body weight might not be more than 60 kg. I know a couple of senior orthopedic people, they put a footstool to operate. They put a footstool, they stand on it, and then they operate. And we read their books. We read what they do. We do what they do. We do what they ask us to do. So there is nothing wrong in it. Muscle power and everything, it's just a mindset. At the end of the day, there are sophisticated instruments. All you need to do is you need to use them, and the rest of it, they will do their job.
So, sir, after this, the next question people have is कि ठीक है, पढ़ाई कर लेंगे, पर कितना time लगता है settle होने में? Because that, as a doctor, it takes time. So what is
surgical
your point on that?
surgical branch, surgical branch में ना incubation period is a very big challenge. There's no doubt about it that incubation period is a very, very big challenge. But I mean, when I talk about that incubation period, we have to understand one thing, that in surgical branches, this is a disadvantage over medical branches. Okay, this is certainly a disadvantage over medical branches, but at the end of the day, when you reach a particular age and stage, after that, there is no limit. After that, there is no limit. After that, you can demand what you want. Can I just share the screen for a minute?
Yes, sure, sir.
Can I get the host right? I will just share a screen.
Correct. Yes.
Okay, so what the reason why I'm doing this is, so I'll show you something. So basically what happens is that in a medical branch, when we see this, in a medical branch, when we see this, on this axis, if we take age, and on this axis, if we take skill, or, along with skill, if you want to take money, you can take it, because at the end of the day, that is also a byproduct. So in your, I would say late 20s, this is 30s, this is 40s, this is 50s, this is 60s. So in a medical branch, it is an early settlement for sure. But then after a point of time, there is a plateau. See, because as a physician, you cannot say that just for consulting a patient, I'll charge 15,000, 20,000 bucks. No, you just can't. So technically, if you go one step ahead in a surgical branch, then there is a slow incubation period. But after a point of time, then there is a upward rise. So this is basically for a surgical branch, and this is basically for a medical branch. So this is how things happen. So it takes a lot of time for sure, but believe me, that is worth it. That is worth it.
Correct. I'm pretty sure. So now, post understanding this, कि कितना time लगता है? Nowadays there is a craze of MCH fellowships going, super specialization. How does it go, or is this an end branch? What do you suggest students?
See, it's not an end branch. Many people take orthopedics just thinking by it as an end branch. No, it is further divided into sub branches. There are further tubularizations which have happened. Spine is one, scopy is one, joint replacement is one, hand is one, foot and ankle is one, shoulder is one. And many people, after a point of time, when they are done with trauma, then they chose the end branches. Like I'm particularly now dealing with arthroscopy, particularly of the knee, and I'm basically into the sports medicine now, regenerative medicine. So after a point of time, when you're but you cannot just ignore trauma. You can't say that I'll just finish MS and I'll straight away go for arthroplasty, and then for the rest of my life I'll just do knee replacement. No, you have to be good in trauma first, because that is your bread and butter for the first 3 years of your life. But during that bread and butter, you realize that your calling is spine, scopy, hand, reconstruction, sports medicine, and then you go and pursue that. And when you do that, and when you do that one thing 24/7, you actually not only become bigger, you tend to become better, and you tend to become more famous. So you have to be master of one rather than jack of all trades after 6 years. After 3 years of your post-graduation, 3 years of your SRship, after 6 years of your rigorous training, then you have to pick one and you have to excel in that one. So it's not an end match. There are further options and specialities.
That's nice to know. So now, sir, post understanding the entire, how can an orthopedic surgeon settle down? There are pros and cons with every branches, and I'm pretty
Yes.
sure that you, with this long career in this, you have certain challenges. If you can share it with our audience, what are the pros and what are the cons? What is the kind of mindset that a student need to have and understand about the branch?
In surgical branches, the first thing that everybody keeps on asking me is about the work-life balance.
Correct.
What they're asking me is that, at the times of emergency, in the middle of the night, you're going for an emergency. So technically the next day, personal life gets affected and everything like that. I have a very firm belief that for 3 years of post-graduation, definitely you can't choose your life. The life is given to you. Once
Correct.
you're done with those 3 years of post-graduation, in the next 3 years of your SRship, you're supposed to be working hard for yourself because that is the actual time when you're acquiring a skill. After that, it's your choice. I mean, you have to understand that whether you want to deal with quality or you want to deal with quantity. In 3 years of post-graduation, you cannot choose. In next 3 years, you're not supposed to choose. But once you're done with that investment of 6 years, because in medical field, there is only one investment and that is time. So when you're done with that investment of 6 years, after that, when you acquire a particular skill, it is all upon you. You choose to decide that whether you want to go for it or not. I have always chosen in my life quality over quantity. I'm happy with my, outpatient basis. I see 10, 12, 15 patients a day. I'm happy with just 3 surgeries in a week, but I want to do them at my own wish, at my own will, with my own skill. But I don't want to compromise that, if I do this and if I spend an extra hour, if I open my OPD on Sunday also, and etc. and etc. and etc. At the end of the day, the only drawback in a medical career which brings a doctor down is when you overpromise and underperform. My simple mantra is अंडर प्रॉमिस एंड ओवर परफॉर्म. 90% डॉक्टरों की जिंदगी में आज जो दिक्कत आ रही है वो इस वजह से आ रही है बिकॉज दे आर ओवर प्रॉमिसिंग एंड अंडर परफॉर्मिंग. मैं चाहता हूँ कि हम अंडर प्रॉमिस करके ओवर परफॉर्म करें और वो तभी हो पाएगा व्हेन यू आर डीलिंग विद लेस ऑफ क्वांटिटी एंड मोर ऑफ क्वालिटी. बट ये चॉइस आपको 6 साल के बाद मिलती है, तो 6 साल तक आप शिकायत ना करें और 6 साल के बाद आप अपनी मर्जी से चले. आप इन टर्म्स ऑफ मॉनिटरी एस्पेक्ट आप ज्यादा बेनिफिट कर पाएंगे अपना, बजाय कि आप क्वालिटी जो क्वांटिटी में आप डील करते हैं आप उससे भी ज्यादा पैसा कमा पाएंगे अगर आप क्वालिटी पे फोकस करेंगे तो. बिकॉज एट द डे इन कंट्री लाइक इंडिया 80% ऑफ द पॉपुलेशन दे जस्ट वांट क्वालिटी. और वो तभी मिलेगी जब आप उसके पे फोकस करेंगे, आप अपने आप को उसी के साथ एसोसिएट करेंगे. सो एक ही मेरी एडवाइस रहती है. दूसरी मेरी एडवाइस हमेशा ये रहती है, जो मैंने अभी बोला भी था, इन्वेस्ट टाइम ऑन योरसेल्फ. ये एक ऐसा प्रोफेशन है जिसमें कोई और इन्वेस्टमेंट नहीं चाहिए. इसमें सिर्फ और सिर्फ और सिर्फ समय की इन्वेस्टमेंट चाहिए. जितना समय आप अपने पे, अपने स्किल पे, अपने चीजों पे लगाएंगे. पेशेंट्स आर ऑलवेज गोइंग टू बी योर बुक्स एंड योर वार्ड्स एंड ऑपरेशन थिएटर्स आर ऑलवेज गोइंग टू बी योर लाइब्रेरी. तो अपने मरीजों के साथ समय बिताएं. 3 साल की पोस्ट ग्रेजुएशन पे उनकी बात सुने. उनकी बातें सुन के ही आपको अगले पेशेंट के बारे में बात समझ आएगी. तो एक सेट पैटर्न के अंदर फॉलो करें, उन्हें पढ़ें, उन्हें समझें, उनकी जो है ईमानदारी से अपना काम करें. द बेसिक वर्ड इज ऑनेस्टी है. द मोर यू विल स्वेट आउट इन अ वार्ड और ओटी, द लेस यू विल ब्लीड इन अ वॉर ऑफ लाइफ. तो आज अगर हम अपनी जिंदगी में, फॉर एग्जाम्पल, मुझे आज कोई भी ऑपरेशन करना है तो मेरे दिमाग में कहीं ना कहीं उस 2 घंटे 3 घंटे में वो 10 बातें जरूर आती है जो उस सर्जरी को मैंने जब पीजी में देखा था या किसी के साथ असिस्ट किया था या मैंने किसी के साथ किया था. Because at the end of the day, what you do today is nothing but a reflex of the memories that you have gathered at your spinal level with your previous experiences. तो आपने जो अपने अतीत में महसूस किया है, आप उसी का आज इस्तेमाल करते हैं और आपको ऑपरेट करते हुए याद आ जाता है कि अच्छा हाँ, ये बात तब ऐसे हुई थी तो ऐसे किया था तो मैं भी ऐसे करता हूँ.
बिल्कुल.
तो इसलिए अगर आप एज अ पोस्ट ग्रेजुएट रेजिडेंट कोई भी चीज देख रहे हैं, सर्जरी सीख रहे हैं, समझ रहे हैं, तो उसको समझिए अच्छे से, ईमानदारी से, और उसको होने के बाद उसको एनालाइज भी करिए. ये जो है ईमानदारी से करना, पढ़ना, सुनना, समझना बहुत जरूरी
No, sir, this is a very nice thing and very nice, way of ending and understanding how to pick up a branch and how to have a mindset when you're going as a doctor and doing your post graduation. So thank you so much, sir, for joining us today, helping us understand what is it to become an orthopedic surgeon, how has your journey been, and guiding the current medical students. It has been wonderful always to be with you, sir. Thank you so much.
Thank you so much. Thank you so much. And I wish everybody who's watching and listening right now all the best. If you are in MBBS, don't worry. You will definitely carve up your, your further route as you go through. If you are done with it, and if you have cleared your PG entrance, and if you want to pursue the branch, it's amazing. But these are the backbone, orthopedics, medicine. These are the backbone of any hospital. Trauma is something which is unfortunately or fortunately not going to end anyhow. And if you are already doing orthopedics, then please make the best use of your time for the rest of your life. Thank you so much. God bless.
Thank you so much, sir. Thank you.